Well, let's go to a game changer on the consumer side of things, and this one earned an honor this year as the first consumer, uh, you know, uh, product to actually be honored by the Pride class, and that was the Philips Sonicare AirFloss. And I was at IDS when it was first unveiled, and I remember people walking around and just like, "Oh wow, what is this? And how does it work? And what can you use in it?" So, kind of give me your thoughts on it and what jumps out at you.
The consumer side of this is neat because consumer is really a lot of where we're going. You know, I tell my patients all the time, I can provide you the best dentistry I can. My hygienists can provide the best possible, aspect of what they do as the hygiene team. But if you never touch the fuzzy end of the brush, between our visits, what we do doesn't do anything. We're putting brand new windshield wipers on a busted windshield. So what I love about Philips is Philips has taken a really great idea and put it in the hands of the consumer so that they can then provide better home care. And what the AirFloss does, the AirFloss is a device that literally moves air and water through a device and allows people to clean interdentally with it. So what is great about the AirFloss, Kevin, is it's this little device and it has a very small interdental tip, and the patient or the consumer, as the case may be, can actually place this between their teeth in the interdental area. There's a little trigger here, a button. They hit the button. And what it does, as you're hitting that button, is it places a microburst of whatever liquid is held in here. There's a little reservoir right here, door that opens. You can put chlorhexidine in here if you want to. You can put mouthwash. You can put water, anything like that. And then when you hit the button, you get a 1/32 of a second burst of whatever that liquid is combined with air, and it moves through the interdental area. And it blasts. And it's a decent, if you hold it against your hand or just put it against your tissue and don't go in the interdental area, you can feel it sting. This thing generates some serious oomph. And it goes into the interdental area and it blows in there and it removes debris. And what's great about this from a consumer standpoint is I have patients all the time that, when we're in for hygiene and we're brushing and, or we're polishing and flossing, and I have patients all the time say, "You know what, doc, I am not going to floss." Or how often do you floss? And patients will laugh and go, "I flossed this morning." And I'll say, "All right, let me rephrase the question and say, when was the last time you flossed before this morning?" And my honest patients will laugh and go, "Oh, the morning before my last hygiene appointment." So a lot of folks don't floss. And for those that don't, this is a great tool, because what I tell my patients is, hey, would you be willing to buy a device that you can use to clean between your teeth? It takes about a minute or two to use, and I keep one around the operatory that I can use on myself so they can see it. And when I show it to them and kind of explain to them how it works, I'm amazed at the number of people that won't buy kite string, to floss with, but they will buy an AirFloss. And they'll leave and they'll come back and they'll tell me at their next recare, "Wow, doc, that thing, I really like it. I can floss my teeth real quick. It's packable. You can take the little tip off of it. So like a typical Sonicare device, one body, you can put multiple brush heads on it if you want to, so spouses or families can share, one body. And this is the same way. You can take it apart. It charges on the same charger as a Sonicare charges. And people will travel with this. People do use this. And it's a really cool device that allows people to clean interdentally without having to floss. And I love the fact that Philips took that kind of thinking. They took it to the consumer side, so I'm not just providing better care for my patients when they're in the office. If they use the AirFloss, they're providing better care for themselves between visits.